show is bringing us right to, I believe that's 26 after 8 here on the Super Morning Show. DJ Wuberty on the ones and twos there for you. And speaking about DJ Wuberty, you should be on the lookout for him this weekend at the OMSU event. There's so much more happening with this Maulian celebrating their 75th anniversary. He will be there doing some old school jams with the old students of Mahali Senior High School. But anyway, thanks to Winston and the team, that will be happening, and you could be joining them there later on this week. But yes, our friends from Platinum Dentistry are here, and let's say good morning to Dr. Asamoah, Edu Principal Dentist, and also Dr. Norvishie Arkutu. Quite an interesting name there. Lead clinician and consultant at Platinum Dentistry. Good morning to you, lady and gentlemen.
Good morning. Thank you for having us.
Yes. I feel I have my tooth missing already before we start the conversation. But anyway, how common is this issue of missing teeth, right? Because we hear about it, and many of us do not even know that it's a challenge. Because so how common is it when we're talking about this?
So we really wanted to tackle this because it's actually phenomenally common. Mm-hmm. And what we know is that by the time people are in their fifth decade, so 50 and up, mm-hmm. up to half people have at least one missing tooth. Oh. And by the time you are between 60 mm-hmm. and 70, you've now gone as far as 3/4. So, 7 out of 10 of people in that age range are going to have a missing tooth. But whilst we focus in there and we've given some statistics for those that are older, we need to remember that this also happens in young people, whether it's because of trauma or sometimes the body just did not form the actual tooth. So we have this problem that actually spans all age groups. And yet there are solutions. So what we are here doing is really raising awareness of what a huge public health effect this is, but also championing the fact that we are here to be your partners to get a resolution for this.
Does it develop with age?
So a missing tooth can happen in a different number of ways. Right. Like Dr. Arkutu mentioned earlier, you can be born without the tooth. The tooth never formed in your mouth. You can lose the tooth because you were playing a sport or you were in an accident, the tooth was lost. Right. You can also lose the tooth because of gum disease. That tends to be age linked, but it's not restricted to age. Okay. And then you can even lose the tooth because you had a hole in the tooth, it got really badly infected, and it had to be extracted. So you realize that actually age, even though it is a risk factor, it's not really limited to age. Everyone across the spectrum can be affected by this.
But the impact on health, is it that dire? So
it's interesting. I was having a conversation just before we came in, and I was telling the man I was speaking to that teeth are not vestigial. Okay. Teeth are not one of these organs that are in the mouth or they are in the body and we don't know what they do and they have no real function. Teeth are integral to health, to confidence, to even just the way you present yourself every day in life. So when you lose a tooth, let's start with the young children. A young person who is missing a tooth, first thing that they become self-aware. They become aware that they are missing something that other people have that they don't have. And that even affects the way they present themselves to their friends, the way they interact socially. Then it affects speech development. And speech is a habit, the same way that the way you walk is a habit. And so if you learn to speak in a certain way, because you are missing a tooth, say for instance the tooth in the front, it's necessary for you to say the word T. So without the tooth in the front, you can't say T, you say Thee.
That will be difficult.
Exactly. And so you realize that because of that, their speech development is also impaired. And that's just in the young people. Even in the elderly, what we are finding, and I'll say this because most of us know the common ones, but even the act of chewing stimulates a part of the brain called the prefrontal cortex. Wow. And that actually affects your cognitive development. So it's no wonder why a lot of aged people, as they get older, they lose the teeth, they can't chew, and there seems to be a cognitive decline. I'm not saying it's the only cause, but it's connected to it. Even things like eating the right kind of diet. Because now what happens is that because you can't eat chewy food, you give you high carb meals or food that you can easily swallow, and that leads to some kind of dietary deficiencies as well. So the impact is significant. It's such that it's a wonder to me that we don't tackle it more aggressively in our everyday.
I think we should, and probably childhood memories coming to mind now when you lose when you're growing up and you lose a bit of it. We just make fun of it. So and the belief is it will grow back again. But we should be seeking help, isn't it, Dr. Arkutu?
Yes, and of course, if it's a baby tooth which is lost, then that is part of your natural development.
Okay.
But we are now talking about adult teeth that have not formed or that have been lost and are just not there. And the other part is that we really have to think about it. Imagine if every time you're going to eat something, you have to think about where to even position the food. And because of this, what we're basically saying is that every missing tooth has its own story. And we're asking you to share your stories on our socials, which is Platinum Dental Services. And we are saying that let us actually start discussing this and look at the ways in which it's affecting people. Because if you imagine that most people have 28 to 32 teeth, there's a reason why you were made that way. All of a sudden, just because you've got 1 or 2 teeth missing, a lot of people start to ignore that part of their mouth. So now all of the load, all of the chewing, all of the awareness of texture, food, etc. is being done by 50% of the teeth that should be involved in that. So what you're now doing is that you are overworking certain parts of your mouth. And we are looking at expert ways, working with you, making you the center of the actual process to come up with ways to actually restore that function, to restore that actual confidence, and to make you back into being a whole person such that you're able to do some of the things that are taken for granted.
The fear is you may even lose the rest if you're not careful, just by overworking the others. But let's talk about where we can find help, because help is very important. I believe we can do that at Platinum, right?
Absolutely. So at Platinum Dental, what we try to do is that we have a team of experts who are trained specially to give you that kind of solution that is required. And so typically you'd come in, and depending on what the cause of your missing tooth is, or even the pre-existing condition, the team works with you to develop a solution which is custom made for you. So for instance, I'll talk through a very few options very quickly. Now, when you have a missing tooth, you have basically 2 categories of solutions. You can either look at fixed replacements or removable replacements. I'll start with the removable replacement. Removable replacements are an option for replacing teeth which are removable. I always say think of them like a pair of shoes. You wear your shoes throughout the day, you talk, everything, you eat with it, and then at night you take them out. And an example would be what we call the denture.
Okay, so for those streaming online, you can see what's being done now.
So that's a denture. And it's a removable option, perfectly fine. And it's a solution that's available. You can also have what we call the fixed replacements. And these are in the category of what we call bridges and implants. Bridges require teeth already standing in the mouth to be used as a support. And so again, if you look at my model over here, you can have, you can have in-standing teeth, a missing tooth in the middle, and these now basically fit onto that, and then they give you that replacement.
Complete feel.
So if I were to take this off, if you're watching, you can see what I'm doing now. This just comes on and fits onto that. So that's a bridge. It requires in-standing teeth. But then what we call the gold standard is what we call implants. Implants, we love implants because to do the bridge, you kind of have to do some work on the adjacent teeth. Implants literally go in just like it was designed, the tooth was originally designed, and fit in there just like the natural tooth. So basically, implants are what we call the gold standard for replacing missing teeth. But there are a broad spectrum of solutions that are available. And if you come to Platinum Dental, we'll work with you to develop the solution that is custom made for you.
How can people, get through to you when they need help?
So I think that firstly, we really need to stress that there's also no judgment or blame, and that missing teeth happen. So I also had a missing tooth, which I obviously had restored. And we've actually got the CEO of MTN, Mr. Stephen Blewett, who's done an amazing patient testimonial for us about his journey to restoring his missing tooth. So we really want to also remove the actual stigma that some people have, and to say that it happens. Some people are even born with it, and what we are doing is really partnering you and making sure that we're coming up with the actual solution for you. So we are really saying that in terms of what we want you to do. First of all, please interact with us on our socials.
Yes.
Our socials are Platinum Dental Services. Share your individual stories.
Yeah.
Let's actually be bringing this to life. The second thing is that you can call us. We are available on our phone numbers, which is 0302 998 750. So that's 0302 998 750. Also, actually, with our Pink partnership, we are at Lincoln Community School for Run for a Cure this Saturday.
Okay.
So this Saturday, between about 8 and 11, we are available at Lincoln Community School doing our bit for breast cancer awareness. So pop into our store and let's start this journey of partnering you to make sure that we can restore what is actually missing and reduce both the short-term and long-term effects of having missing teeth.
Do you do corporate partnerships as well for institutions, organizations? Do you do that?
Yes, we do. There are a number of organizations that we partner with. EcoBank. I mean, the list is significant, but there are a number of organizations, and we are. There's a long list of organizations. EcoBank, Talo. You know, there are a long list of organizations.
SIC, NIB.
Right.
We are with WARA, Cigna, MSH Insurance, Allianz. So we do have quite a few partners and insurance. But the important thing that we are saying to you is that give us a call. Come in for a consultation. Let us discuss, in detail how this is affecting you and come up with a tailor-made solution by experts who can facilitate actually restoring this. But just as you said, also minimizing the chances that you are going to lose more and more and more teeth. We always need to look at what the actual cause is and try and factor things towards the cause to prevent things getting worse and then to restore things back to what they should be originally.
I believe so. And so just give us a sense of the experience. If I walk into Platinum Dentistry, how's the journey going to be like?
All right. So typically you walk into Platinum, you'll be met by our lovely front desk personnel. Right. You would typically go through a quick registration process, which we take down the details. A lot of the details are relevant for your clinician who you'll be seeing later on. And this includes medical history, so on and so forth. And then after that, you go to see your clinician. During that consult, this clinician is going to spend significant time to find out what is going on with you. Not just physically, because that is usually fairly straightforward, but also how the condition that you have is affecting you socially. Because whatever solutions we present has to tackle that in addition to the physical problems. And then, of course, you go through the relevant radiography, x-rays necessary, and then we plan the treatment that is necessary for you. So that's a typical journey through Platinum.
And it's exciting already. We should all be there. How can we find you? Where can we find you? Are we just finding you in one location?
Yeah, so you can find us at Platinum Dental. We are at Airport Hills. On social media, Platinum Dental Services on Instagram, Platinum Orthodontic Dental Services on Facebook, and our phone number 0302 998 750.
Okay, you know what? I believe that it's not just Dr. Arkutu and Yao who are working there. So let's say shout outs to the team. Maybe some few names that we'll see when we get to your front desk. Maybe hello to some few people before we go.
So we definitely believe in a specialist approach. So other than the dentists, we have a lot of specialists who work with us. So those who are championing the missing teeth, we have Dr. Derry Tuopa, who's actually based in the UK, and then comes down to us approximately once every 4 to 6 weeks.
Great.
We have Dr. Maxwell Ajay, we have Dr. Tomati, we have myself as a specialist. We also have the children's specialist, Dr. Tandani, Dr. Brefo. So we are really, really looking at specialists who are dealing with the individual and then coming together to make sure that not just the physical, but also the confidence and the cognitive aspects of missing teeth are also dealt with.
Any final words too, Dr. Yao?
No, just to say, if you're listening to us now, you're missing a tooth. There is a solution. There seems to be stigma attached to it, and I have patients who have missing teeth which they hide from even their partners. you don't have to do that.
Yeah.
Give us a call. Let's find a solution for you.
And I see these ones that some celebs use and all that. Is it the ornamental one? I don't know how to call it, but is it also part of what you do, or that's more stylish and all of that?
So I think that
because people do that for fun, I believe. I don't know if it's part of.
Yes, so I believe that all of this, well, quite a group of, you know, celebs are now doing a lot of cosmetic dentistry.
Yes.
But yes, missing teeth, that's actually come into it. And so we are really fitting into your lifestyle and meeting you where you actually are. But the fundamental thing is that when it comes to missing teeth, we are really trying to prevent any more teeth becoming missing. And then we are trying to restore not just the missing tooth, but what it represents for you within your life. So yes, cosmetic dentistry, grills, etc., you know, jewelry, that is all there. But then that has to be borne in mind and kept in with always promoting dental health first and restoring what has been lost, so that we are sure that you are going to function and live a totally fulfilled life.
I'm convinced already, and for those of you streaming, you should see how the mascot is smiling at us this morning. And that's what you get when you come to Platinum Dentistry. Grateful to Dr. Asamoah, Principal Dentist, and also Dr. Norvishie Arkutu, Lead Clinician at Platinum Dentistry. Thank you all for joining us this morning. When we